Today we're going to look at the most common causes of hip pain in people with hypermobility. And to do that, I wanted to give you a little broad overview of anatomy, and then we'll go into the solutions after that. Let's look at the pelvis and the hips first. First, I want to look at the hip joint and look at these three ligaments that surround the hip itself. Don't worry, there's not going to be a quiz, but notice how they form a little cuff around the hip. If we take those away, we can also see that there's structures that are deeper than that. This first one here is called the zona orbicularis, which provides some additional stability to the hip. And even when we take that away even further, you can see just peeking out there the acetabular labrum. Now, this brings us to one of the first most common causes of hip pain, which is labral tears. These are incredibly common in people with hypermobility. We don't have an exact figure in comparison to the regular population, but we see this all the time in our clinic. And even though it's a little difficult to see there, let's go ahead and let's bring that up so you can see. We're going to open up the hip a little bit. You can see how that sits right in the groove there, which is called your acetabulum, and then the ball sits right in there. The purpose of the labrum is to provide stability for the hip, smooth movement for the ball and socket joint. And you know you might have problems with this. A lot of common things are clicking, locking, popping, grinding, sometimes even difficulty bearing weight depending on how bad it is. And so that's one of the things to keep in mind. Note this is not something that can be necessarily visualized. It cannot be visualized on an x-ray. It usually requires an MRI. Do you need to get an MRI right away? No. In fact, I have a labral tear in my left hip, and a lot of people will respond well to physical therapy for this particular thing. So unlike another structural deficit, like a hip dysplasia, when the actual ball itself or the socket is misformed, that can be seen on an x-ray. So sometimes if you're having issues and you are going through physical therapy and things just aren't getting better, then an x-ray is a good place to start. If you're still going through therapy and you're still having issues and things aren't getting better, then you might talk to your doctor about getting an MRI. There are many other big ligaments that you can see, particularly around the pelvis, like the sacroiliac ligament. On the back, we have the sacrotuberous ligament, and there are several others as well. But I point those out not so much so you know the individual names, but just so you can appreciate how much real estate these take up around the pelvis and hips. And these provide an incredible amount of stability for the hips. And we know with people with hypermobility that there is a laxity in ligaments. There's often a laxity in ligaments, which means that these things are moving around too much. And so we take additional force into our hips, into our low back. Sometimes people, if a provider can find out that they believe that there's just the ligaments are a huge cause of the person's pain, sometimes doing something like prolotherapy where they inject sugar water into these ligaments or into these areas will help to provide a little additional stability. So let's look a little bit at the muscles now. And we're just going to do, again, another very broad overview of some of the musculature. And just so you can appreciate, again, how much real estate some of these take up. One that a lot of people are familiar with is the psoas. This is the psoas major. There's actually a psoas minor as well. And you can see how it starts all the way up here near the base of the rib cage, T12, L1, your last thoracic vertebrae and your first lumbar vertebrae, and attaches way down on the lesser trochanter here on the inside of the hip. It's also met up by the iliacus, which starts on that inner bowl of the pelvis and attaches to the same place. Sometimes you hear those are referred to as the iliopsoas because you can see how they merge together into a single unified tendon. Now, a lot of people have pain around this area, especially when they start to lift their leg. They can get a pinching in the front of their hip. That's called femoral acetabular impingement, or FAI. Again, if we start to strengthen these muscles correctly, then many of these issues can go away, unless there is like a bony outgrowth, which again would show up on an x-ray. Now, do you want to release these tissues? A lot of people get deep release of these areas. Sometimes it can help, but it can also be overdone. And if you're not strengthening at the same time, then that can cause some issues because you just took away the one thing that is stabilizing the hip. Also, let's point out the glute medius here, which is one of your lateral hip muscles. This is very weak on a lot of people. This is one like strengthened by things like clamshells, side-lying leg raises, that kind of thing. Piriformis, this top one here is one of your hip external rotators. You see there's a group of muscles right around that. And those work together in unison to help the hip rotate. And you can also see these, I would consider these deep hip muscles. So, when we start to do things that are very broad, you immediately go into squats, lunges, things like that. You may skip over some of these muscles, which are really the ones that stabilize your pelvis the most. However, we still should look at a couple of the other superficial muscles, like, for instance, the tensor fasciae lata, which merges into your IT band. You can see here this proximal part where my cursor is actually, it starts out as a muscle, and then it becomes the IT band as it begins to funnel downwards and inserts at and also past the knee. Sartorius is a really interesting muscle that changes depending on the position of the leg. So none of these usually in isolation is the issue. Sometimes they can hurt, but it's usually caused by a muscle imbalance. Obviously, the large muscles can have a role too. You can have weakness in your glute max, and then you can see deep there's that glute medius that we were talking about before. So, which is it? That's always the question. Like, is it a problem with muscle imbalance? Is it a problem with structural issues? Acetabular labrums, acetabular hip dysplasia. It would require a much longer video to get into some of those differences. The key take-home point is that a lot of people, even if they have some structural issues, can improve with exercise. So talking to your provider, looking into whether or not physical therapy is a good option to start is a great thing to consider. And most of the time, even with labral tears, people can improve. Things like a hip dysplasia may often require surgery, but the great majority of these, even muscle imbalances, can be resolved in time, or at least partially reduce your pain with regular physical therapy, working on things like strength and proprioception. So point this out, and then we'll talk a little bit more about solutions. This whole thing has been powered by Zygote Body. They're just a wonderful company. If you want to learn more about your anatomy and you'd like to explore things and become your own best advocate, which I think everybody with hypermobility needs to do, check out zygotebody.com. They have free options, they have paid options depending on your needs. If you want to get started here, definitely check out this video in the corner of your screen now, which is getting started with exercise and hypermobility, because a lot of those exercises are specific to the pelvis and the hips. So it's a great video to check out, and I'm happy to answer any additional questions. Hey, and lastly, if you're looking for specific help for hypermobility, check out our website at healthyconsumerpt.com. We are in the Lansing, Michigan area, but if you're living outside that, and we also offer telehealth options. So depending on where you live, we may be able to help you. So definitely check out our website for more information.